All right, so these are going to be my notes for kinesiology. Kinesiology, the study of movement. Biomechanics is the mechanical principles that relate directly to the body. Pretty much like when I think of what is biomechanics, I think of our frame of reference that we use in OT. Would be the frame of reference for biomechanical. Biomechanical, it looks at, it involves static and dynamic. And there's two types of dynamic systems. The first one is kinetics, which is forces that cause movement, and kinematics, which is the time, space, and mass aspects of a moving system. All right, so descriptive terminology. First, we have medial, which is the location towards the midline. Then we have lateral, which is the location further from the midline. We have anterior, which is the front or closest to the front. We have posterior, which is the back of the body or closer towards the back. We have ventral, which is the same as anterior, it means front. They're interchangeable. We have dorsal, which is the same as posterior, meaning back. They're also interchangeable. We have distal, which is away from the trunk of your body. And we have proximal, which is towards the trunk of your body. Pretty much distal and proximal, they refer to locations on the extremities, meaning like your upper extremities, both of your arms, and your lower extremities, both your legs. We have a superior, which is the upper surface of an organ or a structure, and inferior, which is the lower surface of an organ or a structure. We have cranial, which means head or closer to the head, and we have caudal. We have caudal, which means tail or closer to the feet. Pretty much when I think of that, I think cephalocaudal that we learned in OT in our human development course. Developing from your head down to your tail. Superficial is close to the surface, and deep is further from the surface. Pretty much both of these two terms, they describe depth, like how deep something is, or close. If it's close, it's superficial. If it's deep in there, then it's deep. Supine is laying on your back. Pretty much your interior is part of your body is facing downward. And prone, which is laying on your belly. Pretty much your posterior. Your anterior is facing downward. Oh, fuck. Okay, anyway, so supine is laying on your back, and prone is going to be on your belly. You're laying down on your belly. Bilateral, it refers to two or both sides of the body. Pretty much think of your arms. You have bilateral. Contralateral refers to the opposite side, and espilateral refers to the same side. All right. Segments of the body include your head, your neck, your trunk, and inside of your with your trunk, the subcomponents of that is your thorax, and your abdomen. Your upper extremities would include your arm, your forearm, and your hand. And your lower extremities are your thigh, leg, and foot. So pretty much the segments of the body are head, neck, trunk, upper extremities, and lower extremities. The types of motion, there's a linear motion, which is moving in a straight line, more or less. So pretty much you're more or less moving in a straight line. And there's two types of linear motion, and it's rectilinear motion, which is movement in a straight line, you're going straight to it. And curvilinear motion, which is a movement in a curved pattern or path. Then you have angular motion, which is a movement around a fixed point. When I think of angular, I think of like a pivot. You're gonna be pivoting, like your elbow, and your forearm. Your forearm pivots off of that joint. Also, same thing like with your knee. Like if you have your knee, you extend it outward, you're pivoting it. So that's angular motion. This is also known as rotary motion. Angular motion and rotary motion. All right, so we have joint movements, which is known as osteokinetics, joint movements. We have flexion, which is a bending movement and decreases the joint angle. So pretty much you're decreasing your angle between your joints. Flexion. Extension is a straightening motion, and you're increasing the joint angle. Hyperextension is a continuation. Hyperextension is a continuation of extension beyond the anatomical position. Pretty much like you're overextending, you're going beyond your range of motion when you hyperextend. The shoulder, hip, neck, and trunk can hyperextend without a problem. It naturally hyperextends. Palmar flexion is flexion of the wrist. So pretty much you're going down, you're going to decrease the angle. That's palmar flexion. Plantar flexion is flexion at the ankle. Pretty much going to be like pointing and your toes curled downward. Dorsiflexion is extension at both the wrist and the ankle. Pretty much you're going to be increasing your angle of your at your wrist. So you're going back towards yourself. Same thing with your foot. The up side of your foot is your dorsal part. Dorsey. Abduction is movement away from the midline. So if I'm abducting, I'm going away from the midline. Adduction is movement towards the midline. So you come back towards your trunk or your body, the midline of your body. That's adduction. So abduction is moving away from the midline. Adduction is coming back towards the midline. Horizontal abduction and adduction cannot be performed in an anatomical position. It can either be performed laying down or standing against a wall. You have to go into flexion or abduction first before you do horizontal adduction or abduction. And that's pretty much abduction is a shoulder movement backwards. And adduction is shoulder movement forwards. Radial deviation. Alright, so in the anatomical position, radial deviation is your hand moves laterally towards the thumb side. So you're going outwards towards your thumb. And ulnar deviation is when your hand moves medially towards the little finger side. Zayden, open the door, let her in. Go. Lateral bending is pretty much your trunk bending laterally, left or right. So you have right lateral bending and you have left lateral bending. Pretty much your trunk's going to be going down. Like if you're going to pick up a pencil on your right side or left side, or you're going to pick up something on your right side. So pretty much lateral movement of your trunk is lateral bending. Circumduction is motion in a circular cone-shaped pattern, and it involves So circumduction, pretty much motion is circular or a cone-shaped pattern. Pretty much like you take your arm, you extend it outwards, and you rotate it. I'm going in a cone-shaped pattern, also a circular motion. and it involves flexion, abduction, extension, and adduction. Those are 4 components of circular motion. Medial and internal rotation is pretty much your anterior surface rolls inwards towards the midline. Medial and internal are interchangeable words. So if it's medial rotation, you're going to your surface rolls inward towards your midline. Pretty much talk about the shoulder. It's going to roll towards your midline. And lateral and external is also interchangeable words. So lateral rotation would be anterior surface rolls outward away from the midline. So you'll be rolling outward away from the midline. Left and right neck rotation, pretty much just your neck rotating right or to the left side. So right neck rotation, we're turning my head to the right. And left neck rotation, turning my head to the left. Supination pretty much is rotation of your forearm. Supination, think like you're holding a bowl of soup. Supination, in the anatomical position, you're already in supination, but that pretty much means palms up. Pronation is palms down. You're rotating your forearm, your palms are down. Inversion is moving the sole of your foot inward at the ankle, but I don't feel like standing up on a counter, Moses. Anyway, so inversion, moving the sole of your foot inward towards your ankle, and eversion is moving the sole of the foot outward from the ankle. Remember the sole of your foot, not your whole foot in general, just the sole. So you're turning, like if this was my foot and the bottom part of my sole, inversion would be turning it this way, and eversion would be going outwards. Protraction is linear movement parallel to the ground away from the midline. So pretty much it's going to be parallel, like if I use my arm for an example, and I do protraction, I'm extending my arm away from the midline, parallel from the ground. And retraction is linear movement in the same plane, but towards the midline. So pretty much my arm is going to be coming back. My shoulder is going to be jerking back towards the midline. So that is protraction is extending outward in a parallel to the ground, and retraction is coming back towards the midline. All right.